Department of Health and Aged Care has produced this hot mess. It's a national cervical screening program. The key word there being cervical. Well, it refers to women and people with a cervix. Joining me now is Research Fellow at Women's Forum Australia, Stephanie Bastiaan. Stephanie, we should expect better than this from the Department of Health, surely.
Absolutely, Rita. I think it's very clear that the Department of Health has been infected by activists. This is not a troll account on Twitter. This is the Department of Health promoting radical gender ideology. And it's harmful for a couple of reasons, or three reasons in fact. The first is that it undermines women. The second is that it actually skews our medical data. And the third reason is that it creates an issue where people can be harmed from misdiagnosis. We already know that there are patients who have presented in hospital as one gender and treated according to that gender instead of their sex. People have been injured and some have even died. At the end of the day, this ideology is anti-woman, it's anti-family, it's anti-free speech, and it's anti-science. It seems the Australian Labor Party has been hijacked with it, and the Liberal government is not much better.
Well, yeah, the Liberal opposition is not much better, and they weren't that great when they were in power either. But it wasn't long ago when Anthony Albanese, during the election campaign, was asked the question, what is a woman? And he was very clear in his answer.
What is a woman, Prime Minister?
An adult female.
How difficult was that to answer?
Not too hard.
He was very clear there, Stephanie, about what is a woman, but then we see him in office and the Albanese administration seems to be going down this road of doing whatever the trans activists want them to do. And this assault against language isn't an accident. It's very much a part of cultural Marxism and why we mustn't cede linguistic territory to radicals because, Stephanie, language matters.
Oh, it absolutely does, Rita. But this particular, the harms from this particular language is causing harm to children. It is really changing the construct of our society, and it's sending women backwards. It's more than just language. It's an ideology that's being implemented in everywhere, in the legal system, in the healthcare system, and the harms are enormous.
Well, let's have an example of that. In the UK, we've got health authorities, again, appear to be dazed or confused or corrupted by this ideology. They're claiming that drug-induced excretions from a biological man identifying as a woman, well, they're saying that's as good for babies as breast milk. Tell me a little bit about this crazy story, Stephanie.
This is actually very disturbing, Rita, because the scientific study they're basing this on actually used a biological woman who had been taking hormones to present as a male, who was then trying to induce lactation because the drugs had limited her milk supply. One example with a biological woman, and they're now saying that men can do it too. It is absolutely insane, and even more concerning is that this is supported in Australia. I was reading the Australian Breastfeeding Association handbook last night on induced lactation, and they support men lactating, even though the scientific data is not there to support it.
Now, let's have a look at this footage. A biological male playing against a team of women. It's a women's competition. And when you look at this footage, you can see why it's not surprising that several of the women were injured. Stephanie, that game had to be cancelled midway through because there were 3 players injured. How many incidents do we need to have, whether it's amateur sport or even in professional ranks, before there is a hard and fast rule that if you're born male, you can play sport, but only with the men's competition? You cannot participate against women in women's only competitions.
Absolutely, Rita, that is a great question. How many injuries do we need before we bring it back to biological sex? We know there are differences between men and women, boys and girls. We know that when men go through male puberty, they have greater lung capacity, increased muscle mass, they are stronger, they are higher, they are faster. And so it's no wonder when these men decide to put on a dress and identify into a women's sporting team that injuries occurred. It is happening time and time again, and we need national guidelines. We need Claire Chandler's Save Women's Sport bill now.
Absolutely, and we have seen in sports where injuries aren't a concern, just the unfairness of it, because you have often very mediocre athletes, mediocre in the men's competition, and they identify as women going to the women's competition, and suddenly they're dominating because men are stronger, faster, and that is just a biological reality. That's why we've got men's and women's competitions. That's why we don't all compete together. I mean, this stuff is simple. It shouldn't need any sort of discussion or explanation, but here we are, Stephanie. Stephanie Bastiaan, thank you so much for your time this evening.